Now, the FDA has approved boosters for children as young as 12.
This comes as COVID cases in children, but also overall, are still running high. We're joined now live by Dr. John Sellick, a professor and infectious disease expert from the Jacobs School of Medicine at UB. Dr. Sellick, thank you so much for joining us this evening.
Thank you for having me, and Happy New Year.
Happy New Year to you as well. Thank you so much. First, give me your reaction to today's news that there was approval for the booster shot for Pfizer for those younger teen groups.
Yeah, I think this is going to be very important as we're looking at trying to keep kids in school and keeping the schools open. This 12 to 15 age group, that's the middle school to early high school group, and they've not been eligible for boosters up until now. And I think this is going to be very important as we're moving into what will assuredly be a very large number of cases related to the Omicron variant over the course of the next few weeks. So hopefully the CDC Advisory Committee has a meeting on for Wednesday afternoon. So hopefully by Wednesday evening, Dr. Walensky will sign off on this and we'll be able to get moving on these third doses for this group of kids.
Now, when we look at the case data, we've seen over 100,000 new COVID cases in Erie County over the past 7 days alone. Now, officials have been saying this is the winter surge they expected. What else do you think played a role in those numbers?
Well, I think it's been kind of an unholy convergence with this, that the Omicron variant is hitting us right now. And as we've seen in the New York City area over the course of the last month, their case rate went up absolutely precipitously. And if you look at the data that was added to the State Health Department website today, and that was reported by the Health Department today, our cases have also gone, the shape of the curve is almost completely vertical right now. So the appearance of this highly transmissible variant, and we're just coming off of a period of time where large numbers of people were gathering for Christmas, New Year's, parties in between. I've already heard some stories of particular groups of people where a large number of the people in attendance are already testing positive. So I think all of these really work together, not in the way that we would like things to work together, though.
You know, since the beginning of all of this, March 2020, children, by comparison, have been largely the least affected group. Today, Dr. Anthony Fauci spoke with one of our sister stations, a reporter in New York City, and indicated that the expectation, at least at the national level, is to see more children being not only affected by Omicron and potentially other variants, but also getting sick and even to the extent of getting them in the hospital. Do you see that playing out given the veracity of Omicron just in the past month?
Yes, I think that we've already seen that there's an increased number of pediatric admissions locally and across the country. And people tend to say, well, it's only X hundred or X thousand across the country. That really belies the problem. And if this is your child that's getting this, that there is a relatively small but a defined risk for the pediatric population to get ill and to get hospitalized and perhaps seriously ill. You've heard of the post-COVID inflammatory syndrome, long COVID, all of these things would be very unfortunate. So that's why now that we have vaccines available for the majority of kids, we would hope that parents really rally around this, get their kids vaccinated, and now with the booster being approved for the kind of tween group, that we get them that third dose of vaccine as well.
Just quickly and logistically speaking, with the FDA's EUA today, CDC on Wednesday, what is the expectation, do you think, that we could get those shots in arms of those 12 to 15-year-olds?
I don't know the exact issues of the supply chains, but historically Pfizer has been pretty on top of this in terms of getting their products out into the marketplace. So then it will be an issue of getting the shots actually into the arms, as you say. I would expect that we would probably see some clinics, but we're really relying more And I think it's the great part of this is getting this pushed out to pediatricians locally who are, really been able to do the vaccination system, as well as it can be done. So I would hope it would not take more than a few days to get this moving.
Okay. All right, Dr. John Sellick, thank you so much for joining us this evening. That's all the time we have, and be well.
Thank you. Be safe.